Over 60? Diabetes may already be damaging your body without you realizing it. Many people believe diabetes always comes with obvious symptoms, but the truth is, early warning signs are often subtle and easy to ignore. Feeling tired all the time, going to the bathroom more often, blurred vision, or slow healing wounds may seem harmless at first. But these could be signals that your blood sugar is dangerously out of balance. Left untreated, diabetes can quietly damage your heart, kidneys, nerves, and eyesight. In this video, you'll learn 5 critical diabetes warning signs people over 60 should never ignore, and why recognizing them early could protect your health and independence. As we get older, the risk of developing diabetes increases significantly, especially after the age of 60. Changes in metabolism, reduced muscle mass, and decreased insulin sensitivity all make it harder for the body to regulate blood sugar levels. While some changes are part of aging, diabetes is not a normal condition and should never be ignored. One of the most dangerous aspects of diabetes is how quietly it can develop. Blood sugar levels may rise slowly over time, causing damage long before a diagnosis is made. Many people live with diabetes for years without knowing it, allowing complications to build silently. High blood sugar affects nearly every system in the body. It damages blood vessels, nerves, and organs, increasing the risk of heart disease, kidney failure, vision loss, and nerve damage. Over time, uncontrolled diabetes can reduce mobility, independence, and overall quality of life. People over 60 often mistake early diabetes symptoms for normal aging. Feeling tired, needing more rest, or experiencing occasional dizziness may seem expected. Unfortunately, these assumptions delay diagnosis and treatment. Lifestyle factors also play a role. Reduced physical activity, weight gain, long-term medication use, and poor sleep can all contribute to rising blood sugar levels. Even people who eat relatively well may develop diabetes due to changes in how the body processes glucose with age. Another challenge is that diabetes symptoms are not always consistent. Some days you may feel fine, while other days you may feel exhausted or unwell. This inconsistency can make it harder to recognize a pattern. This video is designed to help people over 60 recognize early diabetes warning signs before serious complications develop. It is not meant to replace medical care, but to increase awareness so you know when to seek professional advice. In the next sections, we'll go through 5 diabetes warning signs that often appear early. Some of these signs may seem mild or unrelated at first, but together they can indicate rising blood sugar levels. Let's begin with warning sign number 1. One of the earliest and most common warning signs of diabetes in people over 60 is frequent urination, combined with constant thirst. These two symptoms often appear together and are easy to dismiss, especially as people age. You may notice that you need to urinate more often than usual, including waking up several times during the night. Even if you haven't increased how much you drink, the urge to use the bathroom may feel urgent and frequent. This change can disrupt sleep and leave you feeling tired during the day. At the same time, you may feel unusually thirsty. No matter how much water you drink, your mouth may still feel dry, and the thirst doesn't seem to go away. Many people assume this is due to hot weather, medications, or normal aging, but persistent thirst is a key diabetes warning sign. These symptoms occur because high blood sugar forces the kidneys to work harder. When there is too much glucose in the blood, the kidneys try to remove the excess through urine. This process pulls extra water from the body, leading to increased urination. As a result, the body becomes dehydrated, triggering intense thirst. People over 60 often blame frequent urination on bladder issues, prostate enlargement, or aging kidneys. While these conditions can cause similar symptoms, diabetes-related urination is often more frequent and comes with increased thirst. Another warning sign is noticing changes in urine volume or color. Urine may appear clearer or lighter because the body is flushing out excess glucose and water. In some cases, dehydration may cause urine to become darker. Waking up multiple times at night to urinate, known as nocturia, is especially concerning. Poor sleep can worsen blood sugar control, creating a cycle that makes symptoms worse over time. Constant thirst can also lead people to drink sugary beverages or fruit juices, unknowingly increasing blood sugar levels even more. This can accelerate the progression of diabetes. Ask yourself these questions. Am I urinating more often than I used to? Do I wake up at night to use the bathroom regularly? Do I feel thirsty even after drinking enough water? Has this pattern lasted for weeks or months? If the answer is yes, it's important to consider diabetes as a possible cause. Ignoring these symptoms allows high blood sugar to remain uncontrolled. Over time, this damages blood vessels and nerves, increasing the risk of kidney disease, heart problems, and vision loss. The good news is that early detection can make a big difference. Blood sugar testing is simple, and early treatment can help stabilize glucose levels and reduce symptoms. If you notice frequent urination and persistent thirst, don't wait for symptoms to worsen. Talk to a healthcare professional and ask about blood sugar testing. These changes are not just inconveniences, they are often the body's early warning that blood sugar levels are too high. Next, we'll discuss warning sign number 2, which involves ongoing fatigue and low energy, another common but often overlooked symptom of diabetes in people over 60. Constant fatigue is one of the most overlooked warning signs of diabetes in people over 60. Many older adults assume feeling tired is simply part of aging. However, when fatigue is persistent, unexplained, and does not improve with rest, it may signal that blood sugar levels are not being properly controlled. Diabetes-related fatigue occurs because the body is unable to use glucose efficiently for energy. Glucose is the main fuel for cells, but when insulin does not work properly, glucose remains in the bloodstream instead of entering the cells. As a result, the body is surrounded by fuel but unable to use it. You may feel tired throughout the day, even after a full night's sleep. Simple tasks such as walking, cleaning, or preparing meals may feel exhausting. Some people describe a heavy or drained feeling that never fully goes away. This type of fatigue is different from normal tiredness. It often appears daily and can worsen over time. You may notice that your stamina has decreased compared to a year ago, or that you need frequent breaks during activities you once handled easily. High blood sugar also causes dehydration, which further contributes to fatigue. Frequent urination pulls fluids from the body, leaving you feeling weak, lightheaded, or sluggish. Dehydration can also cause headaches and difficulty concentrating. People over 60 often blame fatigue on poor sleep, stress, or other health conditions. While these factors can play a role, diabetes-related fatigue tends to persist despite lifestyle adjustments. Another factor is inflammation. Chronically elevated blood sugar increases inflammation throughout the body. This inflammatory state places extra stress on organs and muscles, contributing to ongoing exhaustion. Fatigue from diabetes can also affect mental clarity. You may feel foggy, forgetful, or less alert. These changes are sometimes mistaken for early cognitive decline, but blood sugar imbalance can significantly impact brain function. Ask yourself, do I feel tired most days without a clear reason? Does rest or sleep fail to restore my energy? Has my activity level declined due to fatigue? Do I feel mentally foggy or unfocused? If the answer is yes, diabetes may be contributing. Left untreated, fatigue can lead to reduced physical activity. Less movement can worsen blood sugar control, leading to further fatigue and weight gain. This creates a cycle that becomes harder to break over time. The good news is that managing blood sugar can dramatically improve energy levels. Many people notice increased stamina and mental clarity once glucose levels are stabilized. Simple blood tests can help determine whether diabetes is present. Early diagnosis allows for lifestyle changes, dietary adjustments, and medical treatment that can prevent complications. Ignoring constant fatigue delays diagnosis and increases the risk of damage to the heart, kidneys, nerves, and eyes. Fatigue is often the body's early warning that something is wrong beneath the surface. If you've been feeling unusually tired for weeks or months, don't accept it as normal aging. It may be your body signaling that blood sugar levels need attention. Next, we'll move on to warning sign number 3, which involves changes in vision, another common but often missed symptom of diabetes in people over 60. Blurred vision is a common but often misunderstood warning sign of diabetes in people over 60. Many older adults assume vision changes are simply part of aging and believe they just need new glasses. However, when eyesight changes suddenly or fluctuates, it may be linked to rising blood sugar levels. High blood sugar affects the eyes by changing fluid levels in the lenses. When glucose levels rise, fluid can be pulled into the lens of the eye, causing it to swell. This alters the way light is focused, leading to blurred or distorted vision. You may notice difficulty reading, trouble focusing on objects, or seeing things clearly at a distance. Some days your vision may seem normal, while other days it becomes blurry again. This fluctuation is a key warning sign that blood sugar may be unstable. People over 60 often dismiss blurred vision as eye strain, cataracts, or normal aging. While these conditions can cause gradual changes, diabetes-related vision problems often appear more suddenly and may change from day to day. Another red flag is needing frequent prescription changes. If you find yourself changing glasses often without lasting improvement, blood sugar imbalance may be the underlying cause rather than the eyes themselves. Diabetes can also damage the tiny blood vessels in the retina, a condition known as diabetic retinopathy. In its early stages, this damage may not cause pain but can gradually affect vision. Without treatment, it can lead to permanent vision loss. Blurred vision may also be accompanied by headaches, eye strain, or difficulty driving, especially at night. These symptoms can reduce independence and increase the risk of accidents. Ask yourself, has my vision changed suddenly or unpredictably? Do my eyesight problems come and go? Do glasses fail to fully correct the issue? Do vision changes occur alongside fatigue or thirst? If the answer is yes, diabetes should be considered. Vision changes caused by diabetes are not just inconvenient. They are a warning that high blood sugar is affecting delicate blood vessels. Over time, this damage can worsen and become irreversible. The encouraging news is that early blood sugar control can stabilize vision. Many people notice improvement once glucose levels return to a healthier range. Eye exams are important, but they should be paired with blood sugar testing when vision changes appear. Treating only the eyes without addressing blood sugar may miss the real problem. Ignoring blurred vision allows damage to progress quietly. Early intervention can protect eyesight and prevent long-term complications. If you notice sudden or ongoing changes in your vision, don't assume it's just aging. It may be your body's way of signaling that blood sugar levels are too high. Next, we'll discuss warning sign number 4, which involves slow healing and frequent infections. Another important diabetes symptom people over 60 often overlook. Slow healing wounds and frequent infections are serious warning signs of diabetes in people over 60. Many older adults notice small cuts, bruises, or sores taking longer to heal, but often assume this is just part of aging. In reality, delayed healing can signal poor blood sugar control. High blood sugar damages blood vessels and reduces circulation. When blood flow is impaired, oxygen and nutrients cannot reach wounds efficiently. This slows the healing process and increases the risk of infection. You may notice that minor cuts, scratches, or blisters linger for weeks. Wounds may appear red, swollen, or tender longer than expected. In some cases, healing may stop altogether. Diabetes also weakens the immune system. Elevated glucose levels impair the body's ability to fight bacteria and viruses. As a result, infections become more frequent and harder to clear. People over 60 with diabetes may experience repeated skin infections, urinary tract infections, or fungal infections. These infections may recur even after treatment, which is a key warning sign. Foot wounds are especially concerning. Reduced circulation and nerve damage can cause foot injuries to go unnoticed. Without proper care, small foot wounds can become serious and lead to complications. Another sign is slow recovery from common illnesses. Colds, flu, or minor infections may last longer and feel more severe than usual. Ask yourself, do small wounds take longer to heal? Do infections seem to return frequently? Have I needed antibiotics more often? Do I notice redness or swelling that doesn't improve? If the answer is yes, diabetes may be contributing. Ignoring slow healing increases the risk of serious complications, including ulcers, chronic infections, and hospitalization. Early detection and blood sugar control can significantly improve healing. Managing diabetes can restore circulation, strengthen immunity, and reduce infection risk. Many people see improvement once blood sugar levels are stabilized. Good wound care and regular medical checkups are essential, especially for the feet. Early attention to small injuries can prevent serious outcomes. Delayed healing is not something to ignore. It is often the body's warning that blood sugar levels are interfering with normal repair processes. Next, we'll move on to warning sign number 5, which involves numbness or tingling in the hands and feet, an important sign of nerve damage caused by diabetes. Numbness or tingling in the hands and feet is one of the most serious warning signs of diabetes in people over 60. This symptom is often linked to nerve damage, a condition known as diabetic neuropathy. Unfortunately, many people ignore it or assume it is caused by poor circulation or aging. You may feel pins and needles, burning sensations, or reduced sensation in your fingers or toes. Some people describe it as a numb or dead feeling, while others experience sharp or shooting pain. These sensations may be mild at first, but often worsen over time. High blood sugar damages nerves by interfering with their ability to send signals. Over time, excess glucose injures the small blood vessels that supply nerves, depriving them of oxygen and nutrients. This leads to nerve dysfunction and pain. People over 60 may dismiss these symptoms as arthritis, back problems, or normal age-related changes. However, diabetes-related nerve damage usually starts gradually and affects both sides of the body symmetrically, especially in the feet. Another danger is loss of sensation. When nerves are damaged, you may not feel cuts, blisters, or injuries. This increases the risk of infections and slow-healing wounds, particularly on the feet. Nerve damage can also affect balance and coordination. Reduced sensation in the feet may make walking more difficult and increase the risk of falls. Ask yourself, do I feel tingling, numbness, or burning in my hands or feet? Do symptoms worsen at night? Have I lost sensitivity to temperature or pain? Do I experience sharp or shooting pain without injury? If the answer is yes, diabetes may be damaging your nerves. Early treatment can slow or even prevent further nerve damage. Blood sugar control is the most important factor in protecting nerve health. Ignoring these symptoms can lead to permanent nerve damage, chronic pain, and mobility problems. Early recognition is key to preserving independence. Diabetes is a serious condition, but it does not have to control your life, especially when detected early. Frequent urination, constant fatigue, blurred vision, slow healing, and numbness in the hands or feet are all warning signs your body may be struggling with high blood sugar. If you are over 60, never ignore these changes. Diabetes often develops silently, but the damage it causes can be long-lasting and severe if left untreated. Early action can protect your heart, kidneys, nerves, eyesight, and overall quality of life. If you recognize one or more of these warning signs, consider speaking with a healthcare professional and asking about blood sugar testing. Simple tests can provide clarity and guide next steps. This video is for educational purposes only and does not replace professional medical advice. The goal is awareness, so you can act before complications develop. If this video helped you understand your health better, consider sharing it with someone you care about. Awareness can prevent suffering and save lives. Thank you for watching, and take care of your health.